is a support initiative started by Mumbai Clinic to educate, empower, evolve patients and their close ones, survivors and doctors to come under one roof and share their experience, their emotions, and their zeal to fight against the deadly disease. We all know that receiving a cancer diagnosis often triggers a strong emotional response, whether it's shock, anger, disbelief, or sadness, fear, and a sense of loss. However, support groups like Mitwa provides an opportunity to express yourself freely without getting paranoid about what others might think. We have organized a lot of seminars under Mitwa, including yoga sessions, breathing asanas, emotional intelligence techniques, and seminars on health, diet, and Ayurveda. Today, we have gathered here on the special occasion of International Day of Actions for Women's Health to enlighten us about sexual and reproductive measures to take towards women's health. Women's health is not only related to external healthy skin, but also internal factors like balanced diet and nutrition, good sleep, managing stress, physical activity, and annual health checkups. As we all know, that bodily needs of female changes according to her age and factors like pregnancy, lactation, menopause, and menstruation. Hence, it is essential to consume variety of fruits and vegetables, protein sources such as eggs, chicken, fish, sprouts, chana, soy products, milk and milk products, and a variety of nuts and whole grains and pulses. So without any further ado, let's start with our today's session. Today, we have with us our guest speaker, Dr. Aarti Kulkarni. She is master's in gynecology and obstetrics, Ayurveda, and has done postgraduate counseling psychology diploma in yoga education. She is practicing as a consulting Ayurvedic gynecologist at her own clinic, Shuddhi Ayurvedic Clinic, from 2016 till present. Also working as an assistant gynecologist and embryologist at renowned maternity hospital and IVF center, Thane, since October 2015. She has completed teacher's training course of pre and postnatal yoga. She has worked as assistant gynecologist at Arogya Hospital and Uma IVF Center from Feb 2014 to Feb 2015 and worked as consulting Ayurvedic gynecologist at Charak Clinic, Vashi from June 2013 to May 2014. We are very fortunate to have you, Dr. Aarti. I'm sure that your abundance of knowledge in the field of women's health and your personal clinical experience will illuminate the importance of women's sexual health in ladies attending this webinar today. I request you to start your session and we'll take all the questions at the end of your talk. So please, everyone, note down all your queries and ask at the end. Dr. Aarti, you may go ahead.
Yeah, thank you. Thank you for such a warm introduction. So without wasting much time, let's start. I start presenting.
Yes, you can start the session.
Is it fine? Can everyone see the slides? Can everyone see the presentation?
Yes, we can see.
Okay, fine. So this is a topic of today's discussion, that is time to take action for women's health. Yeah, but why? Okay. See, the women are the real architect of society. Be it in any role, right? Sister, aunt, grandmother, and most important, mother. Yes, they are the real architect of society because most of the health is dependent on female. Right from the birth, because the life starts in the womb, and right from the birth, yes, breastfeeding, that is an immense source of immunity, which जो आगे जाके individual को बाकी सारे diseases से fight करने के लिए मदद करता है, and that is why female health is very, very important as far as the health of the society is concerned. And when we know the health, the preventive attitude is very important, right? So an ounce of prevention is worth a pound of cure. So that is why we should always have the preventive attitude towards female health also. But is it true? No. Prevention to छोड़ो, जो health problems भी होते हैं, उसे भी ignore किया जाता है. And this is not the only reason, but उसकी जो specially designed female reproductive system है, that has many changes, that has many cyclical changes. जो menstrual cycle है, day to day hormonal changes होते हैं body में, and that not only affects her reproductive system but also affect other body organs also, and that is why her health should be high on agenda. So that is why she should get tested herself on proper intervals and get investigated and take the proper treatment also. So that is why on the occasion of International Day of Action for Women's Health, without wasting much time, let's start. That is the time to take action for women's health. As we all know, she has her reproductive cycle and reproductive system, and जैसे जैसे उसके लाइफ साइकिल चलता है वैसे वैसे उसमें कुछ कुछ चेंजेस आते जाते हैं. सो जो टाइम है उसमें दैट रिप्रोडक्टिव सिस्टम स्टार्ट्स गेटिंग शेप. दिस इज कॉल्ड एज प्यूबर्टी. प्यूबर्टी के बाद मीन्स when she gets her first cycle, that is called as menarche. Then reproductive years, even in reproductive years she may face pregnancy related problems, then delivery related problems, then post delivery status, then if she gets some abortion unfortunately, then post abortal problems, post abortal state, जो अलग अलग phases हैं. Then perimenopausal period, menopausal period and postmenopausal period. ये हर एक period की need अलग अलग होती है. हर एक पीरियड में होने वाले प्रॉब्लम्स, उनमें किए जाने इन्वेस्टिगेशंस और उनकी किए जाने वाले ट्रीटमेंट्स अलग अलग होती है. सो स्टार्ट से शुरू करते हैं व्हेन हर रिप्रोडक्टिव सिस्टम स्टार्ट्स गेटिंग शेप, दैट इज कॉल्ड एज प्यूबर्टी. तो प्यूबर्टी क्या है? सी द चेंजेस. यस, this is a period when childhood is connected to adulthood. So this is a period which links childhood to adulthood. So there is a gradual development of sexual characters. The age for the puberty is 10 to 16. But nowadays we can see जो छोटी छोटी लड़कियां हैं 8-9 साल की, उन्हें भी पीरियड आना चालू होता है. Maybe because of some environmental factors, some factors related to diet, because a lot of hormones are there in diet nowadays. Then depends upon the nutrition, her body weight and genetic. That is the age of her mother at the time of puberty and or her elder sister's age. Okay, so what are the changes in the puberty? So there are some external changes, internal changes and psychological changes. Internal changes which we all know कि उसके जो organs है, जो female reproductive system के main organs, ovary and the uterus, this starts getting stimulated by the signals from the brain. वो hormones को जो brain उन्हें secrete करता है, उन्हें receive करना सीख लेते हैं और तो cycle है, जो menstrual cycle है, वो चालू हो जाता है. That is called as menarche. Then there are some external changes. Yes, the development of breast, axillary hair growth, pubic hair growth, growth in height, and there are some psychological changes as well, which is normal. So emotional outbreaks होना, anger होना, struggle in finding your own personality, easy influence, then excite होना, किसी भी छोटी छोटी बातों पे ज़्यादा react करना, curiosity to know, to explore and know about these things, conflicting views with parents, then risk taking behavior and obviously mood swings. लेकिन जब ये सारे changes उस female को ज्यादा हैम्पर नहीं करते हैं, these are normal, but जो उसे ज्यादा हैम्पर करने लगते हैं और when they hamper the society, anger issues है, mood swings है, एक ज्यादा excitement है, अगर ये सारे changes है वो intensity के साथ आते हैं तो हमें उसकी ट्रीटमेंट करनी जरूरी है, उन्हें काउंसलिंग करना भी बहुत जरूरी है. Then let's understand about menstrual cycle. Yes, the normal duration of menstrual cycle should be between 21 to 35 days. Means अगर किसी female को हर एक महीने में 22 days के अंतर से पीरियड आते हैं, then that is a normal cycle for her. अगर किसी को 33-34 days में आते हैं, that is a normal cycle for her. But अगर किसी को 20 दिन में आते हैं और उसको नेक्स्ट पीरियड 35 days के बाद आता है, या फिर कभी 22 days, कभी 34 days, then that is something abnormal, and that is irregular period. Then the duration for the period is 4 to 6 days. Any period beyond 8 days is prolonged period. उसकी भी ट्रीटमेंट करनी जरूरी है. If the interval between two periods is more than 40 days, then that is delayed periods. If it is less, then it is early periods. सबके अलग अलग कारण होते हैं, उन्हें इन्वेस्टिगेट करना जरूरी है एंड अकॉर्डिंगली ट्रीटमेंट लेना भी जरूरी है. तो ब्लीडिंग पैटर्न कैसा होता है? नॉर्मल है होता है. that is okay. But again, if it is heavy, कैसे समझेगा? तो इट इज मोर देन 80 ml इज हेवी, लेकिन ये फिर भी ये मोर देन 80 ml है, ये भी कैसे समझेगा? तो मोर देन 3-4 पैड्स पर डे अगर फुल्ली सोप होते हैं, देन दैट इज हेवी पीरियड्स. इफ इट इज विथ वेरी क्लॉट्स पैसेज है, बहुत क्लॉट्स जाते हैं, देन दैट इज हेवी. एंड अगेन मोर देन 80 days. What is scanty is that period which only lasts for 1 or 2 days and hardly any spotting, hardly any bleeding on the pad. Then कॉमन कंप्लेंट्स क्या क्या हो सकते हैं पीरियड में? तो पेन इन एब्डोमेन, इट इज वेरी नॉर्मल इफ शी इज नॉट इफ दैट पेन इज नॉट हैम्परिंग हर डे टू डे रूटीन, उसे पिल लेके सोना नहीं पड़ रहा है, वर्क में छुट्टी नहीं लेनी पड़ रही, देन दैट इज ओके. लेग पेन, बैक एक, इट इज वेरी नॉर्मल. नोशिया, वोमिटिंग थोड़ा हो सकता है, हेडेक हो सकता है. अगेन मेंस्ट्रुअल माइग्रेन इज डिफरेंट एंड दिस हेडेक इज डिफरेंट. मेंस्ट्रुअल माइग्रेन इज one sided or two sided headache which starts during the period only, and that is with the peculiar signs of migraine, so उसकी अलग से ट्रीटमेंट करनी पड़ती है. Then loss of appetite. So ये पीरियड में हमें क्या क्या केयर लेनी जरूरी है? तो डेफिनेटली नो हेवी एक्सरसाइज, हाइजीन मेंटेन करना है. जो पैड है जो एज अ मेंस्ट्रुअल टूल यूज किया जाता है कॉमनली, वो 6 to 8 hours में चेंज करना जरूरी है. डिस्पोज दैट पैड प्रॉपर्ली. इफ यू आर यूजिंग अ क्लॉथ एंड वॉश दैट क्लॉथ प्रॉपर्ली एंड ड्राइड इन सनलाइट. अगर ये पीरियड में अच्छी तरह से केयर नहीं की जाती है, इफ द केयर इज नॉट टेकन प्रॉपर्ली, देन दैट मे लीड टू इन्फेक्शन, recurrent urine infection, some ascending infection, that is infection in uterus and infection in fallopian tubes. रजस्वला परिचर्या. सी जैसे आयुर्वेद में, आयुर्वेद इज मोर अबाउट, ज्यादा वेटेज उसमें दिया गया है प्रिवेंशन के ऊपर. तो इसीलिए हमारे आचार्यों ने हमें कुछ परिचर्या सिखाई है, दैट इज रेजिमेंट सिखाए हैं. तो जैसे दिन में क्या करना है, कब क्या करना है, इसके लिए दिनचर्या है. अलग अलग सीजन्स में क्या करना है, उसके लिए ऋतुचर्या है. उसी तरह ये जो पीरियड है, पीरियड का जो टाइम है, उसमें वो फीमेल ने कैसे रहना है, क्या खाना है, क्या करना है, उसके लिए ये रजस्वला परिचर्या दी गई है. उसमें सबसे पहले आता है कि रेस्ट करना जरूरी है. यस, इस टाइम में बॉडी को बहुत रेस्ट जरूरी होता है. हम हमेशा देखते हैं एडवर्टाइजमेंट में कि जो मेंस्ट्रुएटिंग फीमेल है उसे शी कैन रन लॉन्ग मैराथन, वो फुटबॉल खेल सकती है, वो लॉन्ग डिस्टेंस ट्रैवलिंग कर सकती है. बट नो, दिस इज नॉट एडवाइजेबल. जब भी उसे पीरियड है, उसे 2 से 3 दिन जब भी ब्लीडिंग होता है, शी शुड टेक रेस्ट. And that is necessary for her health, and that is necessary to avoid all the menstruation related problems. Okay, second बताया गया है कि हमें जंक फूड अवॉइड करना है ये पीरियड में, डे टाइम स्लीपिंग अवॉइड करना है, और सबसे इम्पॉर्टेंट टू अवॉइड अश्रुपात. अश्रुपात मीन्स एनीथिंग विच विल गिव यू इमोशनल आउटब्रेक्स, राइट? जैसे रोना धोना है, या फिर इसी टाइम में कोई वायलेंस देखना, सीरीज देखना, देन ऐसे लिटरेचर को पढ़ाना, दैट विल एजिटेट योर माइंड. तो ये सब चीजें हमें इस पीरियड में, ये जो मेंस्ट्रुएशन का पीरियड है, उसमें नहीं करनी है, दैट वी शुड अवॉइड. Then general hygiene, wash the private parts daily and properly. Normal, and there can be vaginal discharge normal before or after periods or mid periods. There is a defense mechanism of the vagina, and because of that one gets this vaginal discharge. Then if there is any itching, foul smell or pain associated with this discharge, we should always consult a doctor. देन दिस पर्टिकुलर टाइम में, यहाँ पे प्यूबर्टी में क्या क्या कॉमन कंप्लेंट्स हमें दिखाई दे सकती है कि प्यूबर्टी अर्ली आना, मतलब ये जो पीरियड है ये सब अर्ली शुरू हो जाना. जैसे मैंने पहले बताया कि नाउअडेज 8-9 साल की लड़कियों को भी पीरियड आना चालू हो गया है, दैट इज अर्ली प्यूबर्टी. तो उनको जो भी पीरियड रिलेटेड प्रॉब्लम्स है वो भी ज्यादा इंटेंसिटी के साथ आ सकते हैं. देन डिलेड प्यूबर्टी, द गर्ल इज नॉट गेटिंग हर पीरियड, not attaining the puberty even after the age of 16, then there is some point of concern, क्योंकि इसके लिए कुछ underlying क्रोमोसोमल abnormalities हो सकता है, या फिर कुछ इन्फेक्शन हो सकता है. तो 16 साल की उम्र होने के बाद भी अगर लड़की को पीरियड नहीं आता है, then that has to be investigated properly. Then the important मोस्ट इम्पॉर्टेंट इट इज एक्ने, विच इज अ कॉस्मेटिक प्रॉब्लम, ये भी हो सकता है। देन ब्लीडिंग अबनॉर्मलिटीज, जैसे किसी की नई नई शादी हुई है तो उसे उस घर में एडजस्ट होने में थोड़ा वक्त लगता है, राइट? या फिर कोई नया कलीग है, उसे उस ऑफिस में एडजस्ट होने के लिए थोड़ा टाइम लगता है। सो उसी तरह जो नए से ये जो हॉर्मोन्स आते हैं बॉडी में, नए से ये जो ऑर्गन्स उस हार्मोन को रिसीव करना सीखते हैं, उन्हें भी प्रॉपर इस्टेब्लिश होना, उनकी भी रिलेशनशिप प्रॉपर इस्टेब्लिश होने के लिए थोड़ा टाइम लगता है। सो शुरू में पहले 1 साल के लिए उनको थोड़ा बहुत इरेगुलर ब्लीडिंग होना, 2-3 महीने के बाद ब्लीडिंग होना, इस तरह से प्रॉब्लम्स हो सकती है। प्रॉपर साइकिल एस्टैब्लिश होने के लिए मोस्टली 1 साल तो लग सकता है। देन वाइट डिस्चार्ज, फंगल इन्फेक्शन, then premenstrual syndrome, again this is a syndrome which consists of psychological symptoms also, इसमें ज्यादा mood swings होना, irritability होना, या फिर physical symptoms like water retention होना, पैर पे सूजन मतलब swelling on legs होना, ये भी बहुत common है, इसके लिए भी treatment जरूरी है। then mood swings definitely। तो अगर ये सारे चेंजेस जब भी बॉडी में होते हैं, so in the puberty is not only the period of massive change in the body but also it is a period of massive change in mentally also। और अगर इस massive change के दरमियान अगर वो लड़की if she is not following the proper healthy regimen, if she continues to follow faulty lifestyle like late night parties है, junk food खाना है, दिन में सोना है, रात में लेट सोना है, अगर ये सब चीजें वो करती है, then she may land up in some problems like hormonal imbalance। and इस hormonal imbalance को भी अगर इग्नोर करते हैं और ये faulty lifestyle continue हो जाती है, then the most common problem she may land up in, that is PCOD and obesity, which go hand in hand, puberty, obesity and PCOD। So let's understand what is PCOD। okay, so PCOD is PCOS is a syndrome of many symptoms। पहले तो इसमें मेल हार्मोन ज्यादा बढ़ जाते हैं, जिसकी वजह से हमें अनवांटेड हेयर ग्रोथ दिख सकती है, अपर लिप्स पे, चिन पे, चेस्ट पे, यहाँ पे हमें अबनॉर्मल हेयर ग्रोथ दिख सकती है। then anovulation means ovulation ना होना। so this ovulation is the event which is very necessary for the pregnancy। जैसे पीरियड चालू हो जाता है 3 to 4 days, जैसे ब्लीडिंग होता है, उसी दरमियान ओवरीज में, अंडाशय में 4 से 8 फॉलिकल्स का कोहॉर्ट रिलीज होता है, और अंडर सम हॉर्मोन्स, अंडर सम हार्मोनल इन्फ्लुएंस, उसमें से एक ही फॉलिकल होता है जो मैच्योर हो जाता है, और वो ओव्यूलेशन के टाइम पे, मतलब आगे के पीरियड के 14 दिन पहले या फिर मिड पीरियड में, अंडर सम इन्फ्लुएंस ऑफ हॉर्मोन्स, वो फॉलिकल रप्चर हो जाता है और उसमें से जो फीमेल एग है, वो साइट है, वो बाहर आ जाता है और वो ट्यूब पिक कर लेती है। उसके बाद जो रप्चर हुआ फॉलिकल है, उसमें से कुछ हार्मोन सीक्रेट होते हैं और वो रिस्पॉन्सिबल होते हैं प्रेगनेंसी अगर होती है तो उसे सपोर्ट देने के लिए, राइट? लेकिन बिकॉज ऑफ ऑल दीज हार्मोनल इम्बैलेंस, बिकॉज ऑफ सेडेंटरी लाइफस्टाइल, नो एक्सरसाइज एंड एवरीथिंग, इसकी वजह से यहाँ पे कोई भी फॉलिकल मैच्योर नहीं होता है। सारे के सारे फॉलिकल मिड स्टेज में आके स्टैग्नेंट होके वैसे के वैसे ओवरीज के पेरीफेरी में आके कलेक्ट हो जाते हैं, एंड दैट गिव्स द अपीयरेंस, वो ओवरी को पॉलीसिस्ट जैसा बनाते हैं, एंड दैट इज व्हाई देयर इज पॉलीसिस्टिक ओवरी मॉर्फोलॉजी वी कैन सी इन द सोनोग्राफी। ओके, इसके क्या क्या सिम्टम्स हो सकते हैं? तो डेफिनेटली पीरियड रेगुलरली ना आना, आता है तो स्कैंटी ब्लीडिंग होना, या फिर 3-4 महीने के बाद आता है तो बहुत ही ज्यादा हेवी ब्लीडिंग होना, फिर वेट बढ़ना, देन अनवांटेड हेयर ग्रोथ जिसे हम हिर्सुटिज्म कहते हैं, एकेंथोसिस नाइग्रिकन्स जो इंसुलिन रेजिस्टेंस की वजह से होता है। इंसुलिन रेजिस्टेंस मतलब हमारी बॉडी में जब हम कोई भी कार्बोहाइड्रेट्स खाते हैं, हमारे डाइजेशन के बाद उसका कन्वर्ट हो जाता है ग्लूकोज में, वो ग्लूकोज हमारी बॉडी को यूज करने के लिए इंसुलिन इज अ की, right? But because of some reasons, because of this sedentary lifestyle, our body resists to use that insulin, and because of there is insulin resistance, glucose वैसे के वैसे पड़ा रहता है और blood levels जो glucose की है वो बढ़ जाती है। और ये कभी कभी ऐसे सिम्टम्स दिखाते हैं जैसे कि ब्लैकिश डिस्कलरेशन नियर द स्किन फोल्ड्स, दैट इज एक्नेथोसिस nigricans एंड एक्ने एंड डेफिनेटली हेयर लॉस। सो जहाँ पे हेयर चाहिए वहां से वो लॉस हो जाते हैं और जहाँ पे नहीं चाहिए वहां पे वो उगने लगते हैं, दैट इज हिरसुटिज्म। Okay, so this is a pictorial representation. Just acne hai, acanthosis nigricans, then hirsutism, and the middle center picture is showing the differences between normal ovary and the polycystic ovary. So अगर ये polycystic ovary को ना ट्रीट किया जाए, उसे इग्नोर किया जाए, तो डेफिनेटली हमने देखा कि अनओव्यूलेशन होता है और ये ओव्यूलेशन इज नेसेसरी फॉर द प्रेगनेंसी. सो इनफर्टिलिटी, डेफिनेटली नो ओव्यूलेशन नो प्रेगनेंसी, सो दैट इज व्हाई इनफर्टिलिटी. देन मिसकैरेज, यस, जैसे हमने देखा कि जो फॉलिकल रप्चर होता है उसमें से जो प्रेगनेंसी है उसके लिए सपोर्ट के लिए एक हार्मोन सिक्रेट होता है, लेकिन जब पीसीओ के जो फॉलिकल्स रहते हैं, पीसीओ पेशेंट्स में जो फॉलिकल रहते हैं उनका क्वालिटी इतना अच्छा नहीं होता है कि वो जो प्रोजेस्टेरोन या फिर जो हार्मोन है वो उस रप्चर हुए फॉलिकल से सिक्रेट होता है, दैट इज नॉट इन इट्स ऑप्टिमम क्वांटिटी एंड दैट इज व्हाई बिकॉज ऑफ लेस सपोर्ट द प्रेगनेंसी शी मे लैंड अप इन अर्ली मिसकैरेज. देन हमने देखा कि इंसुलिन रेजिस्टेंस भी होता है, तो इसमें ब्लड शुगर लेवल भी बढ़ जाते हैं. सो डेफिनेटली इफ शी गेट्स प्रेग्नेंट देयर इज अ हाई रिस्क ऑफ गेटिंग डायबिटीज इन प्रेगनेंसी एंड दोज हु गेट डायबिटीज इन प्रेगनेंसी आर हाई रिस्क फॉर गेटिंग डायबिटीज लेटर ऑन इन देयर लाइफ. अभी हमने देखा कि ये सब खेल है वो हॉर्मोन्स का है. सो हार्मोनल इन्फ्लुएंस के अंडर ये सब होता है और यहाँ पे इरेगुलर ब्लीडिंग होता है, रेगुलर पीरियड्स ये इसका सिम्टम है. तो अगर पीरियड रेगुलरली नहीं आएंगे तो वो जो एंडोमेट्रियम है वहां पे जो हॉर्मोन्स की एक्टिविटी होती है उन्हें कोई अपोज नहीं होता है, वो शेड आउट प्रॉपरली नहीं होता है. और अगर ऐसे ही चलता रहा क्रोनिकली सालों साल ऐसे ही चलता रहा तो एंडोमेट्रियम आगे जाके एंडोमेट्रियल कैंसर में परिवर्तित हो सकता है. देन अगेन द वेरी कॉमन PCO के बाद very common disorder that is endometriosis. See, endometriosis is, what is endometriosis? That it is abnormal endometrium grown outside of the endometrium, right? So abnormal growth of the endometrium. हमें सबको मालूम है कि हमारे यूट्रस के 3 लेयर होते हैं, एक आउटर लेयर है, मिडल लेयर मसल का है और एक इनर लेयर है. जो इनर लेयर है वो हार्मोनल एक्टिविटी को रिसेप्टिव होता है. तो हर एक महीने में वो वहां पे बेबी के लिए बेड बनता है और अगर प्रेगनेंसी नहीं होती है तो वहां से शेड आउट हो जाता है. तो जब भी किसी कारण वजह से we don't know the exact reason, but किसी कारण की वजह से ये जो एंडोमेट्रियम है वो अबनॉर्मली एंडोमेट्रियम की जगह कहीं और भी ग्रो हो जाता है. तो जब भी वो आउटसाइड ऑफ द यूट्रस ग्रो हो जाता है तो उसे एंडोमेट्रियोसिस कहते हैं. जब भी वो ट्यूब्स में ग्रो होता है तो उसे एंडोमेट्रियोसिस कहेंगे. लेकिन जब भी ये मसल लेयर में ग्रो होता है उसे एडिनोमाइसिस कहेंगे. और जब भी ये ओवरीज में ग्रो होता है इसे चॉकलेट सिस्ट या एंडोमेट्रियोमा कहेंगे. जैसे हमने देखा पीरियड में एंडोमेट्रियम शेड आउट होता है, वो हार्मोनल एक्टिविटी को रिसेप्टिव है, वैसे ही ये abnormally grown एंडोमेट्रियम भी हॉर्मोन्स को रिसेप्टिव होता है और वहां से भी साइक्लिकल शेडिंग होता है. लेकिन यहाँ से बाहर जाने के लिए कोई रास्ता नहीं है, वो ब्लीडिंग बाहर नहीं जा सकता. दैट इज वाई वो बॉडी में ही आ जाता है, बॉडी में ही सिक्रेट होता है. And that is why there is defense mechanism of the body acting on this abnormally grown endometrium. क्योंकि ये जो ब्लीडिंग बाहर आ जाता है वो फॉरेन बॉडी की तरह एक्ट करता है. एंड दैट इज व्हाई आवर डिफेंस मैकेनिज्म इज देयर एंड दैट इज व्हाई यहाँ पे सारे टिश्यू, सारे ब्लड सेल्स जो भी जहाँ पे कोई भी फॉरेन बॉडी है वहां पे ये सब एक्टिविटी होना चालू होता है और सब यहाँ पे एडेजेंस फॉर्म होता है. सो मोर द एंडोमेट्रियोसिस, मोर द एडेजेंस, मोर द पेन. क्योंकि बिकॉज ऑफ एडेजेंस ऑर्गन्स एक दूसरे की जगह से वो अपनी नॉर्मल मोबिलिटी लूज करता है एंड दैट इज व्हाई देयर इज पेन, राइट. कभी कभी एंडोमेट्रियोसिस के वजह से ये ट्यूब्स अगर पीछे आगे एडेजेंस हो जाती है तो उसकी जो नॉर्मल एबिलिटी है एग को पिक करने की वो भी उसे नहीं हो सकती है एंड दैट इज व्हाई दे कैन बी इनफर्टिलिटी. एंड अगेन एंडोमेट्रियोसिस कैन आल्सो कॉज हार्मोनल इम्बैलेंस एंड दैट इज व्हाई इसकी वजह से एक क्वालिटी भी हैम्पर हो जाती है एंड दैट्स व्हाई देयर इज इनफर्टिलिटी. एंड दिस एंडोमेट्रियोसिस गिव्स लॉट ऑफ पेन ड्यूरिंग द पीरियड्स. सो यस, इसके लिए भी आयुर्वेदिक ट्रीटमेंट अवेलेबल है. सो प्रिंसिपल क्या है आयुर्वेदिक ट्रीटमेंट का? तो करेक्टिंग द हार्मोनल imbalance and maintenance of biological clock of menstruation and the treatment of obesity and insulin resistance as far as the PCOD is concerned. And in endometriosis, definitely reduction in pain and to stop the recurrence of endometriosis. सो यस, डाइट, लाइफस्टाइल मॉडिफिकेशन, एक्सरसाइज हम एडवाइस करते हैं. देन सम आयुर्वेदिक मेडिसिन्स आर देयर, एंड डेफिनेटली यस, द पंचकर्मा. In Ayurveda, as we all know, body is made up of three doshas, that is Vata, Pitta, and Kapha. And again, the Vata has its subtypes, that is, and one the most important subtype as far as the reproductive system is concerned, that is अपान वायु. Because अगर बॉडी में किसी भी चीज को बाहर फेंकना है, कोई भी सेल डिवीजन होनी है, तो दिस अपान वायु इज वेरी इंपॉर्टेंट. तो पीरियड के लिए, पीरियड का ब्लड बाहर आने के लिए या फिर ओव्यूलेशन के लिए ये अपान वायु बहुत जरूरी है. लेकिन अगर बात तुष्टि होती है, दैट मीन्स इफ देयर इज विशिएशन ऑफ अपान वायु, देयर हैज टू बी, उसे पैसिफाई करना जरूरी है. एंड फॉर द पैसिफिकेशन ऑफ दिस अपान वायु, बस्ती इज द चॉइस ऑफ ट्रीटमेंट विच इज वन ऑफ द पंचकर्मा. सो वी advise basti. And then there are other panchakarma also which are beneficial for this PCOD and endometriosis, which we can advise according to Prakriti and according to the season. Then again, the awareness part, definitely contraceptive awareness should be there. So contraception भी available है, that is reversible and permanent. Two methods है इसके. So permanent contraception में male sterilization, those are surgical procedures, male sterilization and female sterilization. Male sterilization, that is vasectomy, but one has to take proper precaution with other contraceptive measure also for first 3 months after the vasectomy. Then female sterilization, she can go for sterilization right after the delivery, depending upon the baby's health status, depending upon the baby's age and all that. And she can opt for sterilization even after some period when she wants to get herself sterilized. That there are many methods are available, laparoscopic, abdominal, but nowadays laparoscopic sterilization is the choice because of less post-operative care and easy healing. Okay, then reversible are intrauterine devices. Those are available, but intrauterine device is advisable only for the female who has given a birth to the child. So if she wants to postpone a second pregnancy, or she wants the contraception after the delivery, she may opt for intrauterine copper devices. Then that is available for 3 years, 5 years, and 10 years. But she should always go for regular checkups after the IUD, 7 days after the insertion, then monthly, then 1 month after her first periods after the IUD, and then 6 months, and then yearly she should do the checkups with the doctor. And yes, at home she can palpate the threads of the copper T near the vagina. So she should be careful that she should not get any kind of heavy bleeding and infection. If she suffers from heavy bleeding, if she suffers from foul smell discharge after the copper T, she should get herself tested and the treatment should be advised. Then hormonal में बहुत ही पॉपुलर है, that is OC pills. But OC pills भी अंडर गाइडेंस लेना जरूरी है. कॉन्सिक्यूटिव 3 साल के बाद OC pills एडवाइज ज्यादा नहीं करते. जिनको भी माइग्रेन की प्रॉब्लम है, ब्लड क्लॉटिंग फैक्टर्स की कोई बीमारी है, उन्हें भी हम ये हार्मोनल जो ओरल कॉन्ट्रासेप्टिव पिल्स है वो नहीं ले सकते. अदरवाइज इनिशियली 1-2 साल के लिए ओरल कॉन्ट्रासेप्टिव अंडर गाइडेंस ले सकते हैं. ओरल पिल के साथ साथ भी इंजेक्शंस, इम्प्लांट्स में भी ये अवेलेबल होता है, बट दैट इज नॉट मोर पॉपुलर. देन कैलेंडर मेथड है. कैलेंडर मेथड इज समथिंग, उसके लिए आपको ज्यादा नॉलेज होना जरूरी है. आपको शॉर्टर साइकिल, लॉन्गेस्ट साइकिल, इसका नॉलेज होना जरूरी है. सो कैलेंडर मेथड में क्या होता है कि अगर आपका शॉर्टेस्ट जो साइकिल है, यू शुड -18 फ्रॉम दैट, एंड लॉन्गेस्ट साइकिल है उसमें से यू नीड टू -11. सो इफ द शॉर्टेस्ट साइकिल इज ऑफ 26 days, if you -18 from that, then there is 8. Okay, if the longest cycle is 33, if you -11 from that, that is 22. So 8 and 22. These two numbers we are getting. So between the 8th day to 22nd day is your fertile period. So one should avoid having intercourse between these fertile period. Then emergency contraceptive hai, again that has to be taken under proper guidance, that has to be taken within 72 hours of unprotected coitus. Agar ye, and that it should not be taken on regular basis. अगर regular basis पे contraceptive लिए जाता है, pill लिए जाते हैं, तो she may land up in irregular periods and some menstrual problems later on. Or अगर again this is not the reliable contraceptive, right? So if she gets pregnant even after taking this emergency pill, we advise to terminate the pregnancy. Then definitely the barrier methods, which are so popular, female barrier methods are also there, like in the form of sponges, in the form of diaphragms, but they are not so popular and they're not so readily available. But yes, the male barrier method, that is condoms, that is available, and that is again, this is also not reliable method, but that is readily available, and that is the only contraceptive method which gives the protection from sexually transmitted diseases also. So what is sexually transmitted disease? That is the infection that is spread by the sexual activity. It can be bacterial, viral, parasitic. So bacterial may be chlamydia, gonorrhea, syphilis, and viral may be vaginal herpes, genital warts, HIV, and HPS-AG also, but that doesn't manifest its symptoms on the private parts. Then parasitic, that is trichomoniasis, in which we can see the greenish vaginal discharge. So this vaginal herpes is again responsible for see this genital warts. Genital warts, the main cause of these genital warts is human papillomavirus. So the symptoms of STD, then pain in lower abdomen, abnormal vaginal discharge, painful urination, blisters or ulcers around the genitals, that can be the symptom. Then how can we prevent this sexually transmitted disease? Yes, abstinence. If one is suffering from all these symptoms, then that person should refrain himself or herself from having the intercourse, limiting the partners, talking with the partners about these STDs openly if she or he has suffered from these STDs earlier, or he or she is taking any treatment for the STDs. Then again, use of condoms. Yes, definitely get yourself tested if one is suffering from all those symptoms which I explained earlier. Then get yourself tested, and yes, get vaccinated. Yes, is there any vaccine available for STDs? Yes. For hepatitis B, there is vaccine available, and again, there is a vaccine available for human papilloma virus. That is the virus which causes genital warts. But there are some strains of this virus which may lead to some dangerous disease, that is cervical cancer. Yes, more than 95% of cervical cancer is caused by sexually transmitted HPV, that is human papillomavirus. So this HPV vaccination is recommended by WHO. See, the potency of the vaccine is more when it is taken before the exposure to the sexual activity, and that is why only 1 or 2 dose regimen for 9 to 14 years and 15 to 20 years. But yes, 2 dose regimen with the interval of 6 months for the women who are older than 21 years. Then HPV vaccination के साथ साथ cervical screening करना भी बहुत जरूरी है. 21 years के बाद पैप स्मीयर एवरी 3 year करना बहुत जरूरी है. ये पैप स्मीयर क्या है? तो there is a simple OPD based procedure in which the cells from the cervix, that is inner part, outer part, and a junction between these two parts, that is endocervix, ectocervix and a junction, उसमें से cells scrap करके उसका स्मीयर बनाया जाता है, या फिर वो किसी लिक्विड में या डिप किया जाता है, that is liquid based cytology, और वो लैब में सेंड किया जाता है फॉर द टेस्टिंग. सो ये एवरी 3 years करना जरूरी है, या फिर 30 या एंड देन आफ्टर द एज ऑफ 30, between 30 to 65 years, पैप स्मीयर every 3 years without HPV, और HPV DNA detection test is also available with this pap smear. वो भी 5 साल में एक बार करना जरूरी है. अगर ये सारे रिपोर्ट्स पहले के 21 to 65 years में किए गए अगर नॉर्मल है, तो 65 उम्र के बाद ये टेस्ट करना जरूरी नहीं है. Then yes, these are all reproductive problems which one can face, but definitely there are many other problems which one can face during this reproductive age. That is infertility, recurrent abortions, irregular bleeding, problems due to hormonal imbalances, then fibroids, polyps hai, ovarian cyst hai, pelvic inflammatory disease due to infections while discharge and everything. So one should not ignore even a single complaint related to the periods, and that the female should get tested, get investigated, and the with the proper reason the treatment should be administered. And lastly, menopause. Yes, menopause, this is a stage, this is a phase of women's life where she needs more support. Menopause is a stage in women's life when the menstrual cycle stops. When a woman is not menstruating for 12 consecutive months, then she has entered into the phase of menopause. See, again, this is a phase, this is a period of massive change, mentally as well as physically. The same way there is puberty, there is change in puberty. But during puberty, she attains a lot of confidence. But during this phase, she tends to lose her all confidence. And that is why there are many psychological symptoms, there are physical symptoms and gynecological symptoms. Physical symptoms are joint pain, backache, then urinary incontinence, recurrent urinary infection, hot flushes. Then these are physical symptoms. Then psychological symptoms like depression, mood swings, irritability, and definitely some gynecological symptoms like vaginal dryness due to lack of hormones. There is vaginal dryness, and definitely because of that dryness, there is painful intercourse. Then irregular bleeding, heavy bleeding, scanty bleeding, then dry skin. These are all dry skin or mucous membrane of the vagina. These are all the gynecological symptoms. So one should take more care. One should be more vigilant in this particular period. So there is definitely a good Ayurvedic approach for managing this menopausal syndrome that consists rasayana, that is rejuvenation therapy, lifestyle modifications, medicinal supplements in the form of some phytoestrogens, then panchakarma, relaxing panchakarma in the form of shirodhara, that is continuous pouring of medicated oil or medicated milk or medicated buttermilk on forehead. Then yoga, definitely this is the period where yoga helps a lot to face this problem, physical problems, mental problems, as well as all those gynecological problems like Vipreet Karni, Sarvangasana, then Gomukhasana. These are all different types of postures which helps to fight with this menopausal syndrome. And again, some breathing exercises like Shitli, Shitkari, Brahmari, this helps a lot if the woman is suffering from hot flushes. So under the guidance of proper yoga trainer, she should get trained for all these yoga procedures. And yes, specific dietary guidelines are also important. Then last but not the least, this all is about prevention, and definitely prevention, as far as the prevention is concerned, our diet plays very important role, pivotal role. So I'm going to tell you 5 superfoods for females which are necessary so that they should include those diet in their day-to-day diet. So black raisins, yes, काले मुनक्का जिसे कहते हैं. So these black raisins are very useful in female reproductive system. These are rich in iron. These are rich in calcium. These are good to pacify the vitiated pitta. Then these are good for constipation also, as it is rich in fiber diet. And again, the anti-cancerous properties of black raisins, the research is going on. So this, instead of having cravings, when you have the cravings for chocolate, or when you are just want to munch something, instead of having a bowl of chips or wafers, you should eat this fistful of black raisins every day. Then sesame seeds, yes, in Ayurveda, these are called as, it is used in Artavakshaya, that is scanty periods. So even black ones, even white ones, both are good, but the black ones are more having more medicinal properties. So you can take the laddu made out of it, then any sort of These are oil seeds, so it is rich in omega-3 fatty acids, and this is rich in antioxidants. So any dietary food which is made up of, like तिल का लड्डू है, any kind of तिल का काढ़ा भी बना सकते हैं. So आपके आटे में भी you can use this तिल, and then paratha and everything you can use this तिल. Then finger millets, yes, this is the international year for millets. So this is finger millet, one of the best millet which we have. So this is ragi, finger millet. And again, though it is a carbohydrate-rich diet, it is rich in calcium also, and it is a coolant. So those who are having heavy periods, during heavy periods, one can take this. If the female is suffering from heavy periods and without any cause, if there is no cause and she is just having her heavy periods, she should take this nachni sattva, that is called as, in her day-to-day basis. On her breakfast, she can take the nachni sattva. Then cow ghee. Who doesn't know the benefits of cow ghee? Yes. So the cow ghee is again very important. This gives glow to skin, and in Ayurveda it is compared to the fluid which is there in the nervous system, and the reproductive system is definitely dependent and under control of nervous system. So again, this cow ghee plays important role, whether it is pregnancy, whether it is post-pregnancy period, whether it is menopausal period. Yes, this cow ghee plays an important role in female reproductive system health. And last but not the least, yes, turmeric. As we all know the cosmetic values of this turmeric, but again apart from cosmetic value, ये diabetes के लिए भी बहुत अच्छी है. So as we have seen, the PCOD में जो insulin resistance होता है और आगे जाके diabetes में convert हो सकता है, again for that purpose this is again helpful. And yes, it is a bit dry, it is ruksha, and that is why जब हमने देखा कि PMS में भी water retention होता है, there is some swelling, उसके लिए भी this is very important. So we should include all these superfoods in our day-to-day diet. And again, the sesame seeds are those who are having very heat in the body, they should avoid eating the sesame seeds, and instead of the sesame seeds they can take cumin seeds. Okay, so with this superfoods, here I complete my today's session for the action time for the action for women's health. So thank you so much for your patient listening, and I thank DS Research Center and Mitwa Group for giving me the opportunity to share my knowledge related to this menstrual health, female health, and sexual health. Thank you so much.
Dr. Aarti, it was really a wonderful and informative session, and I'm sure that all the women listening to this has got like new information about their own health. So it was really good. So right now we can take the questions. So you can just type your question in the comment box, or you can simply raise your hand if you have any queries. Rajal has raised hand, so can we just let them speak?
Am I audible?
Yes, yes.
Yes.
Yeah, actually, I wanted to know that nowadays a lot of people getting married late. So does this affect your reproductive system? Or like my mom had a estrogen hormone cancer actually, and she also got married very late and had babies also very late. So does it really does the hormonal imbalance or anything of that sort?
Thank you for the question. See, marrying late doesn't hamper, right? But having babies late, yes, surely it does, right? Okay, because this uterus is made for babies. It craves for babies, it cries for babies. And that is why, because there is no baby for longer time, uterus has its tendency to form its own babies. Okay, when there is no baby in the uterus for longer time, it forms its own babies. And that is why the tendency of getting fibroids is more when they are not having the babies, when they're marrying late and try to conceive late. right? So that is why again this whole the purpose of this whole reproductive system is to have babies. So that is why marrying late is not of concern. But yes, even if you're married at the age of 20 and you are not getting pregnant even after the age of 35, yes, that is a problem. Okay.
So is your query cleared, Rajal?
Yes, yes, absolutely. Thank you.
Okay. Do we have more queries?
Yes. Can I ask my question?
Yes, yes, you can go ahead.
Yeah. Hi, Dr. Aarti. It
Hello.
was a wonderful session. I have just one question. In your daily practice, you are coming from a background of gynae and ops, and you're applying the Ayurveda knowledge, right, in your practice to see female patients. Are you seeing patients who are coming with this perspective of awareness point of view? Like, are you getting patients who are asking for HPV vaccine?
No. No,
Okay.
frankly speaking, no. I think there is more awareness that is needed. Again, definitely when we say means there हम जैसे हिस्ट्री लेते हैं, राइट? अगर हमें लगता है कि हिस्ट्री में उनके there is some history, genetic history of some cancer or some reproductive system का कोई कैंसर है, तो हम उन्हें अवेयर करते हैं, so that they can take all those vaccination and they can get themselves tested. If the sister is having some problem, if the mother is having some problem, then we make them aware that they should also be cautious regarding their health.
Okay. Yeah.
Yeah.
Thank you.
Okay, Dr. Aarti, I want to ask something. I think nowadays we are getting more, like we are getting this white discharge, which is we are seeing very common in females. So what is the reason behind it and what is the solution?
See, white discharge is very, very common because it is physiological also. It is normal. See, when one female is getting white discharge just before periods, between the periods, and just after the periods, it is normal because there is vaginal defense which is there. There are some glands which continuously secrete some discharge which consist Dodeline's bacilli, and that is helpful for the defense and to maintain the pH of that particular area. But yes, if that discharge is hampering her and that discharge is having some foul smell, if the discharge is if she needs to wear some pad or panty, if it is an excessive, if there is some excessive discharge and it is associated with foul smell, it is associated with back pain, pain in abdomen, and itching, burning, if all those symptoms are there, definitely this discharge is because of some infection. And
Okay.
then she should get herself tested. Local examination has to be done. Which kind of discharge, whether what is the color of it, and the history of partner and recurrent discharge, and then there should be some treatment according to the cause.
Right. Okay.
Right? There can be fungal infection, there can be bacterial infection, as we have seen. There is a parasitic infection. So
Right.
according to the cause, we can do the treatments. And in Ayurveda also, when there is recurrent infection, vaginal infection, one needs to treat the partner also. Right?
Okay.
And yes, because the partner may have the infection, but that is asymptomatic. And when the female is getting treatment, she is getting herself cured. And again, when they have the relation, again, he may transmit that infection to her. And that is why when we see the recurrent vaginal infection, one has to take the history of partner also, and one has to give the treatment to partner also.
Okay.
Yeah.
Thank you. Again, when we are having a lot of PCOS cases, so what is the, proper method or like effective test to identify PCOS at the early stage?
See, at the early stage, definitely sonography. Yes, if the patient comes with the irregular periods, and if I'm seeing that she has gained a little bit of weight, she's having the acne, some hirsutism is there, then definitely first tool is to investigate to PCOS is the sonography, because a polycystic appearance of the ovaries will get in the sonography.
Right.
And then you can work up, hormonal workup is also there, like follicle stimulating hormone, luteinizing hormone, which has to be tested on a day 3 or day 2 of the period. So the baseline levels at the starting of period, that has to be tested, like FSH and LH. And again, one can see with the testosterone also, because there is hyperandrogenism, that is abnormal growth of hair. So there can be increase in testosterone also. So FSH, LH, and testosterone, these three hormones we can test. And again, as we all know that these hormones come from the pituitary, and all the hormones are chemically same. Their target organ is different. That is why we can see their different actions. So if one gets hampered, another, there is high chance that another will also get hampered. And that is why we should test other hormones also. And again, to know the exact cause of irregular periods, that is to see the thyroid levels and to see the prolactin levels. And again, just to know the prognosis of the disease, we can do serum insulin levels and the ratio with the fasting blood sugar. So fasting serum insulin and the fasting blood sugar levels, the ratio we can see. If the ratio is 4 or more than 4, means the fasting insulin, fasting blood sugar, and the ratio with fasting serum insulin.
Right.
Fasting sugar levels and fasting insulin levels. The ratio is, if it is more than 4, then it is okay. But if it is less than 4, then means if the fasting insulin is 20 and the fasting sugar levels are 80, that is okay. Okay.
Right.
But the fasting insulin is 25 and the fasting sugar levels are 80, then that is not
Okay.
Yeah.
And what can be the best menstrual tool you can recommend? Like there are tampons, menstrual cups, pads. So what is the best sustainable one that you recommend?
So there are many, yeah, definitely pads are available, cups are available, tampons are available. But again, every tool has its own advantages. Every tool has its own disadvantages. So definitely sanitary pads are the most commonly used. These are also in different sizes, and these are easy to use. But they are difficult to dispose of, definitely. But if you use sustainable ones, yes. But some females can get some allergies because of these pads, so she can go for use of tampons and menstrual cups. But again, these pads are easy to use, but tampons and menstrual cups, there is some technical skill should be there to use, so those are a bit difficult to use. And again, this with this tampon, they have to change the tampon with every 6 to 8 hours. If she forgets to change the tampon, the whole menstrual blood is there in the touch of that vaginal mucosa, and that is not good. So she should change the tampon with every 6 to 8 hours. And if she is having heavy periods, then these tampons are, I think, not of much use, that they can be the strains or outside of the tampon that can happen. So that is why. And the menstrual cups are also there, but the menstrual cups, again, these are good for heavy periods. Again, this is difficult to use, but you can measure the menstrual blood, and again, this has to be emptied after 6 to 8 hours. So whichever tool is readily available, whichever tool is affordable, she can use that, whichever she finds easy to use. If she is not having the irritation and allergies with the pads, I think pad is the better one. But if she is having the allergies with the pad, she can go for tampon or menstrual cups.
Okay. Thank you so much for your answers. We have one query, which is Rajal has want to know about the Ayurveda Center for Treating White Discharge.
Yeah, I think Ayurveda center means exactly what do you want. All the, I think those who are
She wants the
gynecologists.
clinic. Yeah. She wants the clinic information basically.
Yeah, here in say white discharge, what we can do is, as I told earlier, for recurrent vaginal discharges, we should administer, we should give the treatment to partner also. But even after that, she is having this recurrent vaginal infection, we administer some gynecological modalities are there in the Ayurveda. That is dush, that is Yoni Dhavan, what we call. So in the centers, those who do these all procedures, I think I do in my practice. मैं जहाँ पे practice करती हूँ वहाँ पे मैं vaginal douches देती हूँ patients को, even for the fertility, even for the pregnancy purpose. जब भी patients आते हैं to maintain that vaginal pH, to prevent the vaginal infection, and even if she is suffering from some vaginal infection recurrent, तो वहाँ पे अलग अलग उनकी प्रकृति के हिसाब से, उनके जो भी symptoms है उसके हिसाब से उनमें उनका डिकॉक्शन बना के, लाइक त्रिफला है, दारू हरिद्रा है, देन नीम है, देन इज पोमोग्रेनेट, उसका जो उपयुक्तांग जो हम यूज करते हैं, छिलका जो रहता है उसका, उसके साथ तो दाडिम त्वक जिसे बोलते हैं, तो उसके साथ उसका डिकॉक्शन बना के वी कैन गिव द वेजाइनल डूश, इरिगेशन करते हैं वो पूरे एरिया को फॉर कॉन्सिक्यूटिव 7 days के लिए.
Okay.
Yeah.
Okay. So we have another questions. Renuka has asked Ayurvedic treatment for PCOD. So any specific Ayurvedic herbs or any treatment you have for PCOD?
Yeah. There is one herb, that is Shatapushpa, which is there, and that is very good for PCOD when it is when there is obesity in pregnancy, obesity in PCOD, when there is anovulation in PCOD, for the fertility purpose, Shatapushpa is very good. And when see, again, the PCOD treatment depends upon the symptoms, right? One may get heavy periods, one may get scanty periods, right? So depending upon the prakriti, depending upon her reasons, depending upon the history, we administer depending upon the visheshan of doshas, because one can give the history of kapha visheshan doshas, right? So for that purpose, we need to administer treatment for the kapha dosha, that is Arogyavardhini is there. Then there are some medicines like Lata Karans is there, then Kukut Nakhi Gugul is there. So according to the symptoms and according to the visheshan of doshas, we can administer. And definitely Panchakarma, that is Vaman, that is MSS, then Virechan, that is Parglishan, and definitely Basti, which is very important. And the Sahachar Tel is the drug of choice, I think the oil of choice for the Basti as far as PCOD is concerned. And again, the need of that patient is necessary, whether she wants to get pregnant, and for that purpose she is there for the treatment, or if she is having excessive irregular periods, or if she is having excessive acne, hair loss, and other other symptoms like insulin resistance and all that. So depending upon the symptom and depending upon the need of the patient, we should give the treatment. And definitely अगर आप किसी भी literature में कहीं भी देखो तो PCOD का cure एक ही है, आप कितने भी medicines ले लो, the diet and lifestyle modification should be there.
Right.
Yeah.
So there is another question by Renuka. Ayurvedic treatment for prolapse uterus.
Yes. When prolapse of uterus में again आपको symptoms देखना बहुत जरूरी है. If she is having only the prolapse of uterus, वो जैसे कभी होता नहीं है. There is cystocele also. माइल्ड सिस्टोसिल के साथ प्रोलैप्स ऑफ यूट्रस होता है, उसके स्टेजेस होते हैं, स्टेज 1, स्टेज 2, स्टेज 3 एंड कंप्लीट प्रोलैप्स ऑफ यूट्रस. तो यह स्टेज 1 एंड स्टेज 2 में वी कैन डेफिनेटली कंजर्वेटिव ट्रीटमेंट आयुर्वेदा से कर सकते हैं. अगेन व्हाट इज प्रोलैप्स? प्रोलैप्स क्या है? तो ग्रेविटी की वजह से जो हमारे जो सारे ऑर्गन्स है, इंटरनल ऑर्गन्स, वो लिगामेंट से बांधे हुए हैं. जैसे कि हम कोई एक बाहर बैम्बू से कोई पंडाल डालते हैं और उसे एकदम अच्छी तरह से वो बांध के रखते हैं, बिकॉज ऑफ द डिलीवरी, बिकॉज ऑफ द स्ट्रेस ऑफ डिलीवरी, बिकॉज ऑफ intercourse, and again the age, because of the age factor, वो जो ligaments का जो strength है, मसल का जो टोन है वो थोड़ा सा कम हो जाता है, एंड दैट इज व्हाई बिकॉज ऑफ ग्रेविटी इट पुल्स डाउन, द ग्रेविटेशनल फोर्स पुल्स द जेनिटल ऑर्गन्स डाउन, and that is why they can be the prolapse of the uterus. So cystosil के साथ क्या उनको stress urinary incontinence भी है, ये भी देखना बहुत जरूरी है, तो उसकी ट्रीटमेंट भी जरूरी है. Then if there is any underlying urinary infection है, and again prolapse of the uterus है, तो उसमें conservative treatment stage 1 stage 2 के लिए कर सकते हैं, जिसमें हम मसल के जो भी strengthening जो हमारे मेडिसिन है, जैसे कि विष्णुदुपट्टी है, जैसे कि अश्वगंधा हर्ब है जो मसल के लिए बहुत अच्छी है, वो हम इसमें दे सकते हैं. डेफिनेटली जैसे मैंने गायनेकोलॉजिकल मोडालिटीज बताया, उसमें एक टैम्पून है. सो अलग अलग हर्ब्स के साथ बनाए हुए ऑयल से सोक करके अगर टैम्पून हम यहाँ पे रखते हैं, एंड 3, 4, 5 डेज के लिए हम पेशेंट को भी बाद में सिखा सकते हैं दैट दे कैन एडमिनिस्टर, जैसे वजाइनली पीरियड में टैम्पून रखते हैं, वैसे ही सपोर्ट के लिए इसमें मेडिकेटेड ऑयल के साथ सोक किया हुआ टैम्पून्स वी कैन पुट इन द वजाइना फॉर 5 hours. एंड आफ्टर वो जो उसमें से जो भी मेडिसिनल प्रॉपर्टी है जो ऑयल की, वो सोक होने के बाद उसे स्ट्रेंथ मिलती है, एंड दे में एटलीस्ट पुल ऑन कर सकते हैं जो भी प्रोलैप्स ऑफ द यूट्रस है, वो आगे उनका आगे तो प्रोलैप्स नहीं बढ़ेगा उनका. एंड डेफिनेटली अपार्ट फ्रॉम ऑल दीज मोडालिटीज देयर आर सम योगा पोजेस definitely which are very useful, जो हम उन्हें किगल एक्सरसाइज के नाम से हम उन्हें बताते हैं. बट yes, this अश्विनी मुद्रा एंड विपरीत करनी मुद्रा, इन विपरीत करनी मुद्रा में अश्विनी मुद्रा करना, वो मूल बंध लगाना, ये सारे जो योगा के जो भी प्रोसीजर्स है, योगा के भी कुछ पोजेस है, वो भी हम उन्हें बता सकते हैं.
Right. So many of them are asking for your clinic address. So you just can tell them the name and the address.
Yeah, my clinic is in Thane. It is in Uthalsar, Castle Mill area, and the name of the clinic is Shuddhi Clinic, and this is a specialty clinic for all gynecological disorders. It is a Panchakarma clinic for infertility and pregnancy care, and again the gynecological problems.
Okay, so with that, if you have any more queries, we can just take more.
So here I just want to conclude that कि बस एक ही ट्रीटमेंट के जरिए नहीं, we should apply the whole system, जो भी जितने भी अवेलेबल हमारे पास उसके जो भी उपाय है, वो सारे हमें उसके लिए करने चाहिए. सिर्फ not only medicines, yes, diet part should also be there. Not only diet and medicine, exercise part should also be there. So exercises, yoga, जितने भी हमारे जो भी holistic approach है, हमें उसकी तरफ रखना बहुत जरूरी है, as far as prevention and the treatment part also is concerned.
Right.
Yeah.
So right now, I don't think we have many more queries. So we can end this session. So I would like to pay my gratitude towards DS Research Center and Mitwa to arranging such a educational webinar, and especially Dr. Aarti to take out your precious time and coming here. We would love to have you back for any future events. Lastly, I just want to say one thing, that like how you invest in gold jewelries as it boosts your outer beauty, it is more important to invest in your health as it will boost your inner beauty, and there is nothing beautiful than a healthy woman. So I think with that, we can just end this session. For all the participants, thank you all for joining, and thank you, Dr. Aarti, for coming here. Thank you so much. So we can call it a day. Ma'am, are you there?
Yes.
Yes, we can.
Okay. Thank you so much all for being here and listening to us.